What's good, everybody? It's your guy, Kid Bailey, with the Neapolitan Ice Cream Experience, and I am here to do another interview for you guys. We got another special guest that's about to join us. And so, Mrs. Sidney Bailey, nurse for UMMC, and I wanted to bring her on to talk through, really honestly, her role and a lot of what she does day to day, just to kind of give you guys a little insight. And so, I guess you could tell people a little bit about how we met and our relationship, and then from there, I guess your job title and just a brief overview.
We met originally in high school. I had a long distance relationship for a long time, which was very hard until he was able to move here. I went to nursing school here in Clinton, Mississippi, which is Jackson area. I went to Mississippi College for 4 years, graduated, and decided I wanted to stay around this area because I really liked the idea of working at UMMC, which is a bigger teaching hospital here, and it's ran by the state. So I knew that I would get to see and experience a lot of things that I may not be able to experience. So that's where I am now. It's called cardiac step down, which just means a step down from the ICU. But we do get a lot of cardiac surgery patients. We get a lot of patients that have had heart caths done to check for blockages and stuff like that after a heart attack. But it's more so just like a normal cardiac telemetry floor.
Pull back the curtain, 7 to 7, I guess. As soon as you walk in, you got your coffee or whatever you're eating for breakfast. Like, how does a typical day look in it for a nurse, on the cardiac floor here in Jackson?
I always have my caffeine. It's either gonna be coffee or some kind of energy drink or something like that. Usually get there around 7 and figure out which night nurse had my patients. Sometimes it's one nurse, sometimes it's multiple nurses that they split the group up and you get report from multiple people. And then we do rounds. We round on our patients. We have 5 patients on our floor. Make sure they don't need anything emergently at the moment, and then night shift usually leaves. And then I get my station ready. From there, we do our morning med pass, give all of our daily meds to our patients, and then usually try to chart all of our assessments. And then we have a meeting during the week every day that's called MDT. It's multiple disciplinary team meeting. So then after that, I'll eat lunch, and then at some point give like lunchtime medications. Usually there's a round of meds around lunch, insulin, stuff like that. After that, give report to night shift. Sometimes you give report to the same night shift nurse unless they're going to be off. So sometimes you just give updates. Sometimes you have to give full report on all of your patients.
Yeah, that's a lot. That is a lot. So in regards to these meetings that y'all have, are they like weekly meetings, or like we're talking like every single day y'all have to have?
It's at 11:30 every day. So because we have such a high turnover rate of our patients like getting discharged and new patients coming in, we have a meeting every day.
And then, with your experience in the Jackson area, one thing I was curious about was like, I guess, what's a good culture expectation coming into this industry? Obviously, different hospitals are going to be different, obviously, because you got different team members and different people, which, is going to give its own unique effect. But in regards to like just overall, what are your thoughts on that?
Yeah, so that's another reason, I meant to say that earlier too, that's another reason why I have stayed at UMMC for so long and why I came back, especially to the same floor that I've been on literally since like 2018 College. Or whenever it was.
Yeah.
Is because for the most part, our team on 3 South, which is where I work, has stayed the same. We have like the same core people who are there to work as a team and be there for each other and also be there for the patients.
Awesome. Well, what's one thing you feel like no one knows about nursing?
I will say one thing that always makes me laugh that you talk about is saying that it's like Grey's Anatomy or like medical shows, and it's not. Like the environment is like completely different from that. We really don't see the doctors very much. It's mainly just us kind of doing our own thing. And then another thing I guess would be that I thought of would be like nurses kind of have to use humor a lot of times to kind of get through their day, because some things can be really hard and may not be the best coping mechanism, but I mean, we have to do something to get through our day sometimes. So
yeah, taking care of people all day, every day definitely can be tough.
Yeah.
For sure. How would you classify a good versus bad day, like in your line of work? I guess would a good day just be, someone, being sent away out of the hospital that is doing a lot better? Or like, I guess for the people, give a little context there. What's a good versus bad day?
Whenever I feel like I have a good day, it's when I feel like things haven't gone super chaotically. The day's gone pretty smooth and there hasn't been like any codes, obviously. Hopefully no rapids, which is like a rapid response is kind of what it is before a code. Like the patient still is responsive but going downhill.
Yeah.
No codes or rapids. And for the most part, your patients are like doing okay, didn't have to send anybody to the ICU. And like you said, if you get to discharge, like say, a patient who came in for an open heart surgery and they're super excited to go home or go to rehab just for a few weeks and like get their strength back, and they're a lot of times like you make connections with those patients because they're there for a while.
Yeah.
So just getting to see their joy and happiness whenever they get discharged after, and they feel so much better.
Yeah.
Or like having a stent placed or something, they just can't believe how much better they feel after that. So that would also be a good day.
Yeah, I'm sure that does make y'all feel good inside too.
Yeah.
Okay. And then I'm assuming, bad days, I guess somebody coding and not being able to be with us anymore.
Yeah.
What would you say classifies a successful nurse?
Yeah, I feel like that is a hard, touchy question.
Some might feel like it might be certification based. Some might feel like it's all experience. Some might feel like the salary that they negotiate defines what successful is.
Well, our salary is based off of how many years we've been a nurse, so how much experience we have. So I feel like there's not really that much of a, defining that with how much money you make, because that's just based off how much experience you have, and everybody is the same. So like if you've been a nurse for a year, everybody who at UNC who's been a nurse for a year makes the same thing. So it's not really like any negotiations with that, but but obviously you can be an RN with your associates or your bachelor's degree, but we don't like talk about that. It's not like, oh, are you an associate nurse? Like we view each other as equally qualified. At the end of the day, we're all a registered nurse because we took the NCLEX. But I will say you can kind of tell which nurses are more so struggling. So you just have to make sure you're focused and you're doing what you're supposed to be doing, basically.
Gotcha. Get in, get your feet wet, grind, and the money will follow because it's all based off of overall experience. This is all UMMC working out of Jackson, Mississippi. What are your pros and cons in regards to your position? And to be honest, let's go with cons first. Like everybody wants to hear the bad news first. Let's hear the bad news first, then let's go to the pros so we can, talk through everything we love and we enjoy.
You're on your feet a lot. You don't sit down
12
much.
hours.
Yeah, it's not really much downtime. And also, of course, like changing patients is not always the most pleasant thing. We're all used to it at this point.
Yeah.
And there's no judgment whatsoever. But if that makes you squeamish, then it's not the position for you.
Or the pooping.
Yeah, any bodily fluids, blood. Like, even though I'm a nurse, I'm still going to be helping change patients and doing other stuff too.
Yep.
So also, you're dealing with people. So, like, you're always going to be dealing with people who seem like they're ungrateful, just to be frank about it. They treat you like they don't care, like they don't want to be there, but they need help, so they came to the hospital. So, sometimes that can be really hard to try to take care of somebody who is basically treating you bad.
Yeah, I know what you mean there. That makes sense. And then for the pros, the things that you love.
I will say, like I said earlier, the team that I work with, the people that you work with makes a really big difference. Also, just seeing the patients who like get to leave successfully.
With that being said, I wanted to pivot to the part everybody wants to hear. The whole reason you go to school to even become this. The money. What would you say is an entry level salary expectation for a nurse?
Whenever I started, it was like $24.50 an hour or something like that, which is not very much. I think what is that salary? You know better than I do.
$24.50. That's gonna be
It's
under
pretty
50K.
low.
It's like
Yeah.
48,
Yeah.
49, something like that.
Now I think that the starting out rate is going to be more like 29 or 30 an hour.
That makes sense.
Also you do have the opportunity to make overtime. So you can, I think that at UMC they let you work as much overtime as you want to. And a lot of times if they're really short, like hospital wide, they'll offer what's called a bonus shift. And I think other hospitals do it too. So it may be like a bonus $20 shift. So that means $20 on top of your hourly rate. Plus it's going to be an overtime shift. So you get shift diff after 3 p.m. I think. So there's lots of opportunity to make more if you're willing to pick up, if you have the time and if you're willing to pick up. If you have a bachelor's degree, you could try to go into management. I don't know if I would necessarily recommend that unless you're just really passionate about it, because you could make close to it as a PRN nurse, which is what I'm doing, if the hospital will let you work. And then just like
so
other
from
admin
a promotion
roles.
aspect, going management is the way to get the money in regards to speed. But, like she said, if you don't enjoy managing people, then it really doesn't matter. But overall, I would assume, everybody has their own angle that they want to pursue. So, if that's something you would be interested in, that'd be perfect. Any advice you'd have for anybody looking to get into this?
I do think that being a nurse tech helped me a lot, because being a new nurse, you're very intimidated by working with patients. Like if you haven't been in that environment before, just get a little bit of experience doing something, or possibly do LPN first, and they can give medications and stuff, just not IV medications, and their school is shorter. So they don't make as much, but if you want to just try to get started and see if you're interested in it without doing the whole entire nursing school thing, that would be a good way to see if you're interested. And nursing school, just pray. Keep your head down, be focused, don't have a lot of distractions going on, because if you have any type of distractions in your life at the time, it's going to be very hard. It's going to be really hard. So it's hard anyway, so when you have other things going on in your life, it's almost, I'm not going to say almost impossible, but it's really hard. And everybody you talk to that's a nurse is going to tell you that nursing school is extremely hard.
Well, we appreciate you for stepping in and giving us a peek behind the curtain.
Thanks for having me.
In regards to nursing. And so appreciate y'all for tuning in, and we got more interviews on the way. So appreciate y'all. We'll catch y'all next time. Peace.
Bye.